So thank you for having me, Uli. It's a delight to be here. I'm taking a very grounded approach to this topic because a lot of the things that we learned at AliveCor are, I think, steps that small companies should be thinking about even in the early planning stages. So this is a very practical talk about how to think about data, how to think about your end user, whether it's a patient or a consumer. Some people question if those are even the appropriate titles for our customers these days. So it's more a practical guide to be thinking about what you should be doing when you're planning implementation and scaling of your product. That should have said AliveCor. I don't know why that's blank. Okay. Anyhow, so AliveCor is a digital health startup that's been around since 2012. I've been with the company for about 3 years. We are pioneering the creation of FDA-cleared over-the-counter EKG devices, as well as machine learning techniques that enable proactive heart care. We were labeled the #1 in machine learning by Fast Company in 2018. We have a lot of physician buy-in over the years, particularly because of its accessibility and low cost. And as a result of this, we have over 83 peer-reviewed manuscripts, and we're also cited in several US, Australian, and European guidelines. We have 11 FDA 510K clearances and 3 CE mark devices. But the talk is really not so much about AliveCor, it's lessons that we've learned along the way. So a lot of the CEOs we've had over the years, and if you've counted, we're now on our 7th, they all come to the company, I think, with one idea in mind, is that they want to be working on a technology that will be guarding people's hearts for a lifetime. And that's not just outside of the clinic, that's all the time. And as a result of that, you have to think about the different hats that the person can wear over a lifetime. Sometimes they're consumers, sometimes they're patients, sometimes they're both. And that's all great and well to think about, but that really will affect how you organize your data, how you think about privacy and security, your relationship with the FDA. So it really does affect the nuts and bolts of your digital health company. So this is an example, look at the slides. This is an example of the AliveCor journey nowadays. What's complicated about it is that everyone knows about this company as a consumer electronics company. You can purchase a device on Amazon, but we do have the enterprise software face for the last 3 years or so, where physicians can have a relationship with us, and then when they want to prescribe KardioMobile, this single lead ECG, they can give their patients a 10-digit code. And when the patients put that 10-digit code into the app, it basically converts it to a patient-doctor relationship. And now every time you take an ECG, it gets uploaded to this portal where the physician or the nurse can review the data. So at that point in time, you are transforming your user from being a plain old consumer to a patient. Everything changes. But as you know, you don't, at least in 2019, from a payer point of view, you don't need to be checking your EKG forever. So there's going to be a certain point where you terminate that relationship. And now you're into this new zone where you're both consumer and patient. You have data in various places. And this is kind of brave new world for us in terms of how we are thinking about the arrow in purple. So first access for our products is really on Amazon. 2 years ago it was primarily on our website, but now it's Amazon. And you can see we spend a lot of time focusing on the stars. Well, I don't, but the marketing team does. And so just like any consumer journey, you're thinking about the placement of the words, the reviews, the coloring of your images. We now have 2 products in the market. We have a 6-lead ECG, KardioMobile 6L, and a single lead ECG KardioMobile. So every day we have a team that just kind of pours through reviews, and they're usually bimodal, 1 or 5. We get a lot of ones from competitors. There's this whole group that basically is working on combating trolls, which is kind of an interesting place to be. So the key thing here is not what we're having to to deal with, but the fact that our consumers, the people who are using our device when they go to Amazon, they fundamentally have price transparency and choice, right? You can see that one product costs $150, the other one costs $100. Moreover, they're paying for the device before they receive their care, right? Most of us, we go see the doctor and then we pay the copay, or 2 months later we get a bill in the mail. And so you fundamentally also have choice. The consumer is always correct. If they think it's not worth the money, then they're going to write 1 star and then return this piece of crap, right? So it's just a very different experience. And then you also get the 5-star reviews, right? KardioMobile saved my life. Better than expected, as expected. So we also have this other side. This is the one I'm spending more time with day to day and thinking about the patient journey. It involves our software as a service, our enterprise software called CardioPro. It involves our relationship with the press, whether it's in the Times or elsewhere. And most importantly, it involves the research that's being done. A lot of it is investigator initiated. There's some that we sponsor. But I think we're most proud of the high quality research that's really beyond the pilot phase. We do have some multi-center RCTs. We have RCTs that have lasted for 1 year in duration for monitoring for AFib. And particularly in Europe, we have a remote patient monitoring program that's looking at patients, now actually up to 300 patients and over 5,000 ECGs over a year as well. So implementation, high quality studies looking at quality of life and cost are things that we're really focusing on these days. But going back to consumers versus patients, what are the differences? As we know, patients pay for their health care after and not before their care. There's a lack of price transparency and limited information about not only who their doctor is, but the quality of the healthcare provider and the efficacy of the treatment they're going to receive. And in emergency situations, there's limited to no choice. So patients do not have the same price transparency and choice that the consumers do, even though in our model, sometimes they're the same person. So when you're building a product for consumers and patients, I think the goal has always been on the product team to make it patient-centric. And that fundamentally means that you're respecting the values and preferences of your user. And that would be the same thing as really putting the customer first. Our new CEO is from Amazon, and she's always talking about being customer obsessive. And I think that would be the same language we would use in a research context if you're thinking about what patient-centric means. Just being obsessive about what a patient would want. So it's not only being respectful of values and preferences, but it's also making that care affordable, collaborative, and accessible, really trusting the patients as partners, and bringing in the medical community because there's a huge role for them to play in getting your patients or consumers to trust you. So we have some user interface examples of our 6-lead product, and it was a struggle, I think, to provide the data in a simplified way that still got the message across, that it was more than a single lead device. So it took a lot of time and effort on the UI and UX end to work on these ideas. So going beyond the building a product, how do you make the product grow? This is where I think the reality check came in for us along the way, and a lot of it is just being exposed to the laws and regulations that dictate how to take care of your consumers and patients. It really does take having good digital health legal counsel in data privacy and security, as well as knowledge of the corporate practice of medicine, having regulatory input about whether your product, your software or hardware is a medical device. Is it pure OTC, over the counter? Is it prescription only? Is it both? And then also knowing the alphabet soup about reimbursement. So earlier we heard about category 3 CPT codes, but there's other codes you can use, whether it's a HCPCS code, if it's a drug code, whether you're using your FSA or HSA. So this is something I think particularly relevant to know, that new laws are coming out in January 1st of the next year, particularly the California Consumer Privacy Act. This will affect all businesses that collect data on 50,000 California households per year or make 25 million in revenue. And basically it's protecting any personal data that's coming from a California resident. And it's a broad business sector. It's going to affect almost everyone. And it includes individual rights to access, but also erasure of the data, and the right to opt out of the sale of data. And you might say, well, I'm not selling data, and AliveCor isn't either, but there's still this expectation that they can click on a button on your webpage and say, do not sell my data. There's also going to be broad implications for the privacy policies for every company that's affected by this. If you're a digital health company, you also need to think about other privacy laws, including HIPAA and GDPR if you have data in the EU. HIPAA, as you know, is protecting US patient data, and specifically it's data related to healthcare, or payment when it's associated with at least one of 18 identifiers. And importantly, it has to be related to data that's being received or under the care of a covered entity like a provider or a clearinghouse. So it's very specific. I think most companies in the health field will think about HIPAA, but now they have to think about the CCPA law as well. So for example, you have US data. Which law applies? I'm not a lawyer, but we've been working on this problem for a while, or thinking about it. So if you have PHI, that is subject to regulation under HIPAA, and there are particular regulations about privacy and security, how frequently you're doing audits and logs of the data, for example. But there's lots of other health data that's not PHI, and that will be subject to the CCPA law. For example, health data that's collected directly from a user with no covered entity relationship. So our consumers, the folks that are purchasing Cardia on Amazon, those people who are entering their medication data, their EKG data, that will be under the purview of the CCPA. But when they have a Cardia Pro relationship, they're working with their physicians, and the doctor overreads an EKG and writes sinus rhythm or whatever the outcome is, that is PHI, and that's covered under HIPAA. And this is true even of California residents who are actually not in the state and they are traveling, for example. You still have to think about their data when they're international. Okay, so there's some legal complications, but I think there's a lot of good resources on the web. I would encourage if there's any confusion over the law, and I think most companies are still confused, including us working through it. You can find good resources on the web. But now we'll move on to the regulatory side of things. So you've got a product, not necessarily hardware, it could be software, a mobile app. Is it regulated by the FDA? Why does the FDA matter, right? So the FDA is this body that ensures that the public health is safe. They want to regulate medical devices to make sure that they're safe and effective, as well as drugs. And the key thing to know about medical devices is it's not just EKG hardware or a defibrillator. It can be software as well that claims to treat, diagnose, cure, mitigate, or prevent disease. So it could very well apply to your product. And I think another key thing to remember is it just allows you to market your device. It doesn't mean that physicians will want to use it. It doesn't mean that payers will pay for it. So it's kind of the first step, but it's a very important step. And there are some new CPT codes, reimbursement codes, that are explicit about requiring that for digital health that your device is in fact a regulated medical device by the FDA. So to show you the nuances of what this means, there's lots of wearables that provide heart rate monitoring, and they might provide an assessment of cardiac arrhythmia, whether that's through a PPG or heart rate directly or ECG. And so it's not an easy question if whether your product is in fact a medical device. So strictly speaking, if you have a device that has a medical purpose, and importantly, it would pose a safety risk if it doesn't function as intended. So for example, the Apple PPG app that tells you if you have possible AFib or not, that is a medical device. If you have any ECG that is showing a display to a user, that is a medical device. However, there are some devices like the Garmin strap that goes around your torso that's using ECG to accurately measure heart rate, and their claims are that they are helping athletes and encouraging a healthy lifestyle. So if your claim is for general wellness or for fitness claims, then you are not a medical device, you're exempt under 21st Century Cures Act, and you don't have to go through this whole process. And finally, there's a whole list of mobile apps that have, they're under something called enforcement discretion, where they are apps, but they pose a lower risk to the public health. For example, they collect and trend glucose, blood pressure data. Perhaps they are clinical decision support that are using existing peer-reviewed apps or calculators like CHADS 2 VASC, for example. So those are under enforcement discretion and traditionally not considered a device. Okay. So that's the regulatory side of things. So it's really helpful to have some input on that end, whether you are subject or not to FDA regulation. Finally, the reimbursement side, which is still a tricky one for us, admittedly. So on the consumer side, you people pay for it. They go onto Amazon, they purchase KardioMobile. You can use your health savings account, your FSA. Sometimes there are large kind of corporate wellness deals with an insurance company, providing, for example, Apple Watches to all of their users that they do so many steps per day. So there's different payment models for that. If you're on the patient side of things, I think most companies are searching for the holy grail, which is the subscription model. So that would tend to be something like a software as a service or some type of algorithm as a service. And there are new Category 1 CPT codes that would help facilitate this type of arrangement where you can have an ongoing subscription relationship with a practice, and then the provider will be billing monthly to Medicare for remote patient monitoring. So that's one option. Patients can pay for it, of course. And then there's going to be alternative models, whether you have equipment, traditional medical equipment, like you can use HCPCS. So there's lots of different modeling opportunities. I'd say, personally, we've struggled with the one-to-one relationship. Should we be giving these out to individual patients or the one-to-many? You give one to a doctor and they use it like a traditional ECG. So you also don't want to cannibalize your own revenue stream. So it's something to think about and be reflexive about, but also know when you need to change course and pivot. So in summary, I would say that patients will never be complete consumers when it comes to healthcare. As I mentioned, those traditional market forces as delineated in Arrow's Sentinel paper, talking about price transparency and paying for a product, a widget before or after, not having enough information about the quality of the good in front of you. So that's all nice and well, but I think what's happened practically speaking is that laws and regulations for the practice of medicine, for data privacy and security, for marketing and selling devices, again, under the purview of FDA regulation, and reimbursement, they basically make you distinguish your patients from your consumers. So we, as a practical strategy, we have on AWS PHI in one location, we have consumer data in another, we have patient data in another, and that will, these types of infrastructure on the back end at the onset of the company were really important. So even bringing in the engineers early on to think about this is important. And the challenge, the excitement, is to empower and delight both user types in light of these complexities for a lifetime. So thank you very much.
Two questions for Jacqueline.
Yeah.
Can you comment on the value of the 6-lead medical value beyond single lead? My understanding, both of them are indicating for arrhythmia.
Sure. Can I show a demo first? So people know. Okay, let me show this here. Okay. So this just came out in July of this year. So the 6-lead is a limb lead. So for marketing purposes, we are not claiming anything more beyond the algorithms that we already have. So we have atrial fibrillation, bradycardia, tachycardia, normal sinus rhythm. But the nice thing about a limb lead is that you have better P wave detection in the inferior lead sites. So for 2, 3, and F, for those who read ECGs, you have much better discrimination of things like typical atrial flutter, SVT, AV block. If you are an EP enthusiast, you can start to identify PVC locations. So there's lots of other more esoteric utilities, LVH and AVL. So, yeah.
Can you talk about use cases where you would use AliveCor versus, say, the Apple Watch 1 lead or the HeartBeam 12 lead equivalent on either end?
So why use a single versus a 6 versus a 12? So a single lead is pretty good for a lot of conditions. I think for example, it's very easy for people to use. So from a usability point of view, it's important. So it's a rhythm strip. Traditionally, that's what we call a single lead ECG. So atrial fibrillation is a classic one that can be reliably evaluated in a single lead. Of course, there's cases where you just can't see the fibrillatory waves that well, so you need to look at a different lead. So for the most part, in most people, you can do pretty well with rhythm detection and lead 1. You start to move into the inferior leads, particularly lead 2, when you want to make assessments like QT interval, when you want to look at flutter waves, as I mentioned before, which is like the cousin of atrial fibrillation. If you want to understand the relationship between the P waves and the QRS complexes, there's kind of a better region of leads to go to. So I would say from the practical business end, this is really providing more information to a cardiologist rather than a primary care physician who might want a basic rhythm assessment with a single lead ECG. A 12 lead, of course, is fantastic for ischemia. There's lots of data that you would get in the precordial leads, V1 through V6, and that might be more looking at things like Brugada, LVH, left ventricular hypertrophy with repolarization, of course, ischemia, hypertrophic cardiomyopathy. So the more leads you have, the more you get, but I would say you get pretty good bang for your buck with a single lead.
Thank you.
Yeah.